Hello and welcome to the OASIS Collaborative. We are optimizing antibiotic stewardship in skilled nursing facilities. Previously, on OASIS, we talked about why antibiotic use in skilled nursing facilities matters, how skilled nursing facilities affect antibiotic use, and now we will talk about the pre-prescribing component of the OASIS intervention. The OASIS intervention is a comprehensive organization-level intervention designed to improve antibiotic stewardship in participating skilled nursing facilities. This video is one part of a series designed to provide education about the OASIS intervention to nursing home staff. In this video, we will go over the changing condition form. In addition, we will present clinical scenarios to illustrate how the form can be used in a variety of situations. Let's talk about the changing condition form, which is the pre-prescribing component of the OASIS intervention. The purpose of the OASIS intervention is to modify the structure and processes related to antibiotic prescribing in skilled nursing facilities, which means we're going to modify the tasks, tools, and organizational influences at the structure level in order to introduce process changes related to delaying testing and treatment of residents with low-risk changes in condition, and introducing opportunities for post-prescribing antibiotic review and optimization in order to reduce the number of antibiotic starts when appropriate, shorten the antibiotic duration when appropriate, and narrow the spectrum of antibiotics prescribed when appropriate so that we can reduce incidences of C. difficile and antibiotic resistance. There are 4 components of the OASIS intervention, including the pre-prescribing and post-prescribing components at the frontline level, and process checking and performance monitoring at the organizational level. In this video, we're focusing on pre-prescribing. The pre-prescribing tool is a changing condition form that can be used by nursing staff at the skilled nursing facility that improves communication between the nurse and the prescriber and promotes active monitoring in low-risk cases of changes in condition. The pre-prescribing process, as mapped based on observations and interviews and focus groups that we conducted in a number of skilled nursing facilities, including your own, is as follows. And the pre-prescribing tool has a number of uses to improve this process, including improving the nurse assessment of the resident by providing a structured template for information gathering, improving the preparation for prescriber communication based on that template, and improving the interaction itself with the prescriber. And finally, providing opportunities to improve the nurse-to-nurse handoff when needed if the prescriber is not reached by the end of the shift and the nurse needs to hand off the information to the nurse in the next shift. The core of the pre-prescribing tool is a decision aid at the bottom of the first page of the form, which presents the nurse with an opportunity to assess the risk of the changing condition based on the information collected in the form, and to use a script that is suggested here to recommend to the prescriber whether to perhaps take an active monitoring approach rather than ordering, testing, and ordering antibiotics. And now we will talk about some examples of how the form is used in practice.
It may be helpful for you to have a copy of the change in condition form in front of you as we work through these examples. As we look closer at the OASIS change in condition form, keep in mind it will help consolidate documentation in one location, identify residents at higher or lower risk of infection, suggest active monitoring for residents at lower risk of infection, and schedule an antibiotic review 48 to 72 hours after an antibiotic start to evaluate the continued appropriateness of the antibiotic order. First, we have Mildred Axel. She's resided at your facility for some time now. Staff know her preferences and daily routines well. This morning, a nursing assistant who frequently assists Millie with her morning cares reported to the nurse that Millie just isn't herself today. She's very tired and a bit confused. Millie walked to the bathroom with the CNA, used the toilet without difficulty or complaints, but then wanted to go back to bed. Millie usually gets washed up and dressed and goes to the dining room for breakfast with her friends. Millie has mild dementia and occasional incontinence. The CNA took her breakfast and lunch trays into her room, but she did not eat or drink much. When the CNA told the nurse about Millie's change in behavior, the nurse assessed Millie. She again had no specific complaints, no reports of pain, just didn't feel well. Her vital signs were all within normal limits and her lungs were clear. Using the OASIS intervention, once a change in condition has been identified and the resident has been assessed, the nurse completes a change in condition form. The nurse first describes the current change in condition, then the nurse completes background information, general information in B1, and vital signs in B2. Only check the boxes on the right side of this section if they meet the parameters given. Document localizing signs and symptoms of the urinary, respiratory, and GI tracts, or of the skin and soft tissues in B3. Document non-localizing signs and symptoms in B4. In section B4, here we note Millie has new or worsening confusion, agitation, decrease in eating or drinking, and sleepiness. This brings us to the risk assessment piece of the OASIS process, when the nurse determines if the resident is at a higher or lower risk of infection. Beginning on the left side, Millie's vital signs were all within normal limits, nothing checked in B2. Answering no at this first diamond leads us to the next diamond to the right, localizing signs and symptoms, any checked in B3. We did not check any localizing signs in B3, so we again move to the next diamond to the right, non-localizing signs and symptoms, any checked in B4. She did have several non-localizing signs and symptoms identified, so we follow the yes arrow to lower risk, go to R2. As this may be a new process, if the resident is determined to be at a lower risk of infection, you may use the suggested script found in the lower left corner of the assessment section to share your assessment with the provider. Proceeding to the second page, section R2 suggests recommended monitoring and supportive care orders to follow instead of obtaining a urinalysis or starting an antibiotic. This is followed by a section where you can document what notifications and communications were made, as well as space for nurses' notes. So as an overview, using the OASIS intervention with this scenario, once a change in condition was identified, the resident is assessed and the change in condition form is completed. This process determined the resident was at a lower risk of infection. You continue to monitor the resident and update the provider using the suggested script. In this case, we are hopeful the results of using the OASIS intervention will be that the provider gives orders for staff to conduct active monitoring, no urinalysis or antibiotic prescribed. If the resident returns to baseline, you have avoided an unnecessary antibiotic, along with its side effects, risk for Clostridium difficile, and increased chance of resistance. The provider may choose to give different orders or prescribe an antibiotic using their professional judgment. The nurse's responsibility is to provide complete, accurate information about the resident for them to make their decision. Next, we have Ms. Lesher. She's 91 years old with chronic urinary incontinence and recurrent urinary tract infections. She receives macrobid, nitrofurantoin, prophylactically for urinary tract infections per the urologist. She develops pain with urination, pyuria, increased urgency and frequency, and increased confusion. She has an elevated temperature of 100.1, but her other vital signs are within normal limits. Using the OASIS intervention, after identifying her change in condition and assessing Ms. Lesher, the nurse will complete the change in condition form, including current situation and general background information in B1. In section B2, the nurse would document her temperature of 100.1, which is elevated, but it does not fit the parameters given to check the temperature box on the right side of the section. You would only check that box if the resident's temperature was greater than 100.5 degrees or repeated temperatures greater than 99. Moving on to section B3, Ms. Lesher has several localizing symptoms. She does have one non-localizing sign and symptom in section B4. This brings us to the risk assessment portion of the OASIS intervention. Again, starting on the left, did we have any abnormal vital signs checked as defined in section B2? No. Even though her temperature was elevated, it did not meet the criteria set to check the box for temperature. So we answer no and follow the arrow to the right. The next diamond asks if there are any localizing signs and symptoms checked in B3. Yes, we had several checked in section B3, so we follow the arrow up and over to higher risk of infection. That directs us to section R1 and R2. Moving on to page 2, the recommendation section. R1 is for residents deemed to be at a higher risk for infection. It includes recommended orders the provider may give when the staff call to update them on the resident's change in condition with a higher risk of infection. In our example, the provider ordered a urinalysis with culture and sensitivities if indicated, Cipro 500 milligrams every 12 hours for 10 days for a UTI, and to discontinue the macrobid while on Cipro. They also ordered staff to monitor Ms. Lesher's vital signs every shift and monitor her food and fluid intake. Under the communication section, staff document who was contacted and when the contact was made. Where the form asks about pending notification tasks, which is highlighted here, it is noted that the resident's primary care provider will need to be updated, letting them know about the resident's change in condition, antibiotic start, and schedule the antibiotic review, which is covered in the antibiotic review post-prescribing video. Returning to the overview, using the OASIS intervention, all pertinent information was collected in one location. The resident was determined to be at higher risk of infection, provider was contacted, and new orders received. In addition, in what may be a new part of the process, the primary provider was updated on Ms. Lesher's change in condition, and an antibiotic review was scheduled to determine the appropriateness of continuing the antibiotic when additional information is available. Now we have Mr. Dean. He has dementia, and he fell last night trying to get up out of bed. He sustained a laceration on his arm. Prior to this, he had no signs or symptoms of a urinary tract infection. After assessing Mr. Dean, the nurse will complete the OASIS change in condition form, completing the situation and background sections. Using the risk assessment section, Mr. Dean was assessed to be at lower risk of infection, but was sent to the emergency room due to the laceration on his forearm from the fall. Several hours later, Mr. Dean returned to the facility with his arm sutured and an order for Cipro. Following the OASIS intervention, the primary care provider was informed of the antibiotic start the next day, and the antibiotic review was scheduled. Why was Mr. Dean prescribed Cipro? To find out, watch the OASIS intervention antibiotic review post-prescribing video. Using the change in condition form, we avoided an unnecessary antibiotic for Mrs. Axel, who was at low risk. We scheduled an antibiotic review to consider modification of the order for Ms. Lesher, who was identified at higher risk, and we scheduled an antibiotic review for Mr. Dean, who was prescribed the antibiotic in the emergency room. In summary, in this video, we've addressed the change in condition form and how this form consolidates important clinical information, helps facility staff assign risk, and helps prescribers identify an appropriate plan for managing a change in condition. For additional information on the antibiotic review form, the post-prescribing counterpart to this form, including examples of how it is intended for use, the background and history, see the other videos in this series.